Hey everybody, the Tree City Growthcast is being brought to you by our company, Tree City Creative. We are a full-service creative marketing company, and we absolutely love helping to produce things like brand videos, social content, podcasts. We do live event production and programming. If it involves getting your messaging down and then helping to get that message captured beautifully and then out to as many people as possible, we would love to help you out with your endeavors. So please, get in touch. Matt Pieper is here. He runs an organization called Open Hand. It is here in Atlanta, Georgia, and we'll let him tell us about it. But they focus on nutrition and feeding folks from economically challenged areas, specifically, mostly in the city, right?
Primarily, yeah.
Right.
But other areas too, rural areas of Georgia, but primarily in Metro Atlanta.
Right.
Yeah.
Okay, so I'm so fascinated by anyone who's doing as much good in the world as what you are. So tell us a little bit first, just how you found Open Hand, how you got into the nonprofit world, and tell us about it.
Well, I'll try to give you the Reader's Digest version because I've been around the block a long time, right?
Yeah.
So, communications major in college, went to work for the Atlanta History Center right out of college, working in public relations and publications, and got introduced to the fundraising world and the world of not-for-profits, and had a series of jobs afterwards, really, really fun, cool, meaningful roles working for several different healthcare organizations. One was the AIDS Research Consortium of Atlanta, which was doing clinical drug trials and an epidemiological study for the CDC during the height of the AIDS pandemic. And then eventually I went to work for a international PR firm and worked for a lot of not-for-profit clients there. Eventually became an executive director for a family retreat program for families going through serious illness. So health has always been sort of a special focus of mine. I was with that program called Deliver the Dream for 8 years. We helped a lot of families going through, all kind of different challenges, cancer or autism or sometimes renal failure. And from there, I went to work at Open Hand. Right. And that was, 16 years ago.
Wow. Well, I specifically love what you guys do. So I frame what my wife does in similar terms. She works for a nonprofit where they dig wells all over the world.
Yeah.
And I see health, water, and nutrition as being sort of the first rung on the ladder of economic development. Because if you're not healthy, you're not personally developing.
Yeah.
Even especially as a young child. And I think what you guys do is so important. So how do you do your work? How does Open Hand, how does it work?
How do we work? First of all, collaboration is absolutely key because nutrition is integral to building healthier people, right? Investing in people, but that's how you build healthier communities, right? So we collaborate with amazing partners across the city and really across the state. We have a philosophy at Open Hand. So what we do there is we cook up and we package and we deliver really healthy meals and also run nutrition education programs and nutrition counseling. So we're helping people to understand the connection between really healthy food and good health outcomes, right? So many of our clients are either battling cancer or renal failure or diabetes, heart disease, HIV, or they're battling multiple chronic and serious health conditions, right? Or they're greatly at risk. We serve a lot of older adults who are homebound, who oftentimes don't have the strength to cook a healthy meal or stand in front of the stove or even stir, right? And so for those individuals, we are a wonderful resource, and we cook up 5,000 meals a day. And with the help of 14,000 volunteers who are in our database, we package up those meals and then we deliver them all throughout Metro Atlanta and increasingly other parts of Georgia too. We go as far south as Macon. We're up in the mountains of North Georgia. because in the rural areas in particular, there are a lot of food deserts, just like there are in the city of Atlanta. There are just areas where there are not grocery stores, and access to healthy food is hard to come by.
Yeah.
And when I say healthy food, Drew, our meals that we cook up from scratch in our Midtown kitchen, we use grade A quality. Yeah. Everything is high quality standards. Yeah. Very few preservatives, very few canned goods, low sodium, high fiber. We're really designing the menus, and it's our registered dietitians who design those menus, to be tailored to meet the specific health condition that someone is battling. So someone who has cancer may be on a different meal plan than someone who has renal failure or who needs a diabetic-friendly meal, right? So there's a lot of science that goes into designing these menus. And then there's variety. The food is delicious, but everybody should be able to choose. And if you don't like this particular meal, well, we got you covered. We got 2 others that meet your nutritional targets, right? And to us, that's a matter of dignity. There's when you're facing serious health challenges, oftentimes your life can become limited in ways. I think of older adults who may not be able to drive their car anymore, or perhaps they're needing to live with one of their children or grandchildren, right? But food is not one of those things that you should have to compromise on, right? Yes. And so we really pour a lot of science, but also a lot of love in the meals that we cook up. And we always like to say that food is love, but food is also medicine. Socrates. The right kind of food, the right kind of food, right? And we can help people live better qualities of life, right? But there's also, and that's the feel-good part of our mission. That is why so many volunteers come to our campus. That's why I have 125 amazing employees who are dedicated to our mission. But there's also an economic impact and an economic benefit to what we do, because with the right kind of nutrition, we can keep people out of institutionalized care. We can reduce hospitalizations. If we get the right kind of nutrition into people's homes after they've been discharged from the hospital, we greatly reduce the chances that they'll have to be readmitted. Right? I think about senior citizens who sometimes, and not just seniors, but especially seniors who get bed sores when they're in the hospital. And then they're discharged, and if they don't get the exact proper care, which is difficult, then those wounds can sometimes be the reason why they're being readmitted to the hospital, right? But with the right kind of nutrition, those wounds are going to heal faster. And that's just one example, right? We have a hospital discharge program that we run at Open Hand specifically with that goal. Let's help this person not have to be readmitted to the hospital, and that saves our community money, right? So if we'll invest as a community a little bit more in healthy food, and then teach people the connection between healthy food and good health outcomes, we can save taxpayers in our healthcare system a lot of money.
Insurance companies as well.
Insurance companies, hospital systems.
All of our premiums are connected to that.
Not only that, but that's how it's one of the ingredients to building healthier communities, right?
Absolutely.
And we have so many examples around Metro Atlanta of neighborhoods that were in serious decline. But through partnerships and through collaboration, and by making investments in those key social determinants of health, right? Those things that all of us need: affordable housing, right? Nutrition, access to healthy food, good schools, grocery stores, right? And employment. And if you begin to make, and places to do recreation, one of my good friends runs the YMCA Metro Atlanta, Lauren Kuntz, and she's one of my absolute heroes, because the YMCA oftentimes builds their Ys, which are incredible facilities. Oftentimes they're built in areas like East Lake,
where I live, by the way.
Wonderful case study.
I was at the Y this morning, actually. I'm there every day.
Well, and then the Ys are so much more than just a place to go lift weights. They are community centers, right?
They really
There's
are.
all kind of education that can be had. we partnered with them to help create access to healthy food,
Yes.
as have many food access programs, food banks, and Wholesome Wave, which doubles the SNAP benefits at certain farmers markets to increase the amount of fruits and vegetables that families who take a benefit of that SNAP benefit take advantage of. So that I love that Eastlake case. I love what has happened over at Vine City in the shadow of the Mercedes-Benz, another place where a YMCA exists and intentionally built their headquarters, as a matter of fact.
I need to go to that one.
And it doesn't happen overnight, right? But you start investing in these staples: housing, food, recreation, ball fields and soccer fields where kids can and adults can go out and play and enjoy sports. And all of a sudden you'll start to see drug trafficking go down, and employers start to want to relocate to these areas and start offering jobs, right? And you start having these wonderful early childhood training programs, right, that are coming into these neighborhoods to invest even beyond what the Atlanta public school system is able to do. The charter schools over at Eastlake, phenomenal education opportunities. Does he?
He does,
Well, then I mean, and that's what's happening right now in the Grove Park neighborhood. Up on the Upper West Midtown, and I know a little bit about that because that's where I decided to move Open Hand.
That's right. Yeah.
We want to help the folks in Grove Park have access to healthy nutrition and have access to our education, our nutrition education. In fact, we just launched a workforce development program at Open Hand.
Really?
It's a culinary workforce development program.
So it kind of fits within your wheelhouse.
It's in our wheelhouse, right? And if we can teach people how to prepare food in a healthy way, we can set them on a career path. When they graduate from our program, they will have Safe Serve certification, right? And they'll have knife skills, and they'll have, we practice recipes in class, and they're going to use olive oil rather than Crisco, right? And they're not always going to go to the fried foods, but and so we're really proud of this, and it's part of our commitment to neighborhoods that are declining, right? And with the right kind of investments, we can be part of that revitalization. And I love what the Grove Park Foundation is doing in the Grove Park neighborhood. It's a classic textbook case of how you invest in a community. And now employers and companies are wanting to relocate to that area.
Have land there,
right?
Yeah, I mean, lots of.
And the beautiful West Side Park, 320 acres of ball fields and picnic pavilions and hiking trails, and that area is exploding. And 20 years ago, you wouldn't have even driven through that area, right? And so we love that we get to be part of that revitalization. But we love that we can be part of the revitalization of a lot of neighborhoods in Metro Atlanta that need access to healthier foods. Right.
I mean, what you're saying to me is, there's all these truisms that we know, all these old sayings, but the old saying that comes to mind is, an ounce of cure is worth an ounce of prevention is worth a pound of cure, right? So if you get in early and teach people. Also, teach a man to fish, that old saying. And I feel like that's exactly what you guys are doing, because I'm thinking of all the different things and even the joys of my life. Like I love to cook, and prepare food at the house. And so you're also probably teaching when you're getting into olive oil, that kind of elevates the whole experience. In addition to health, you might, start messing with some new recipes, and it just, I feel like it can really expand people's minds and what they see possible through more healthy eating and more adventurous eating even.
You get it, Drew. You get it. Yeah, I love it when we can get to kids early. Kids are curious, and they want to learn. And if you make it fun, you got to make it fun. So one of my favorite things that we do in our cooking classes, we have an 8-week cooking class called Cooking Matters. And we do this for all kinds of communities. We do it for senior citizens. We do it for veterans. We do it for women who receive care in the women, infants, and children's clinics. But we also do it where we're pairing up grandkids with their grandparents, right? Or parents with their kids.
That's so
So the family is learning how to prepare meals in a healthy way together.
Right.
Right. And we're opening up these kids' minds to try things a little healthier. And sometimes we'll have these like Iron Chef Man contest where we're giving these kids and we're breaking them up into groups, providing them with some healthier, simple things like Greek yogurt and fruits and vegetables. Right. And they actually have to prepare something healthy. We give them chef hats and aprons, and then they have to present to a panel of judges, which gives them confidence and, helps them learn presentation skills, but also opens their mind to that, guess what, healthy can taste good, right? And
right,
so,
and be fun. And,
yeah.
I mean, our son, we've got a little 7-year-old boy, and he loves to cook. And so he gets in the kitchen, he's doing what he can, but anytime I'm in there doing it, he'll want to put on a chef hat. He's got, we call him Chef Elon, and he's got that and just loves to come in and do it. So that's such an enriching thing. Like you said, I mean, and what you guys are doing and taking it to another level with the presentation and
thanks for saying that.
Wow.
Your son is probably going to keep those skills all his life, right? And that's going to serve him well because, sadly, we spend more in this country and in this state on healthcare than just about any other country on the globe.
Right.
And yet we continue to have some of the worst health outcomes.
Yes.
Right. We are a nation of a lot of obese people.
Right.
There are epidemic proportions of diabetes, of cancer, and many other nutrition-sensitive diseases.
Right.
That partly is due to the food supply that we have in this country, and also to the fact that people continue to smoke. If people would stop smoking, and if they'll eat healthier, right, and they'll get some exercise, we'd be a much healthier nation.
Right.
Right. And so that's why collaboration is so important because, Open Hand, our core strength is preparing really delicious, healthy meals. But the YMCA, they've got all of these incredible recreation and workout facilities and all this classroom space. And they're a community center, so the community is coming into those Ys.
Yes.
They're the perfect partner for Open Hand, and they're one of many. They're one of many. And so the collaboration piece is so important, and getting to youth early and helping them shape their habits.
Right.
Right. And one day, I think people are going to come back into the kitchen instead of eating out so much. Right. We've become a country where most families eat out more than they cook at home, and that needs to change, right? And so we need to make meals from scratch like our grandmothers did or our great grandmothers did,
right?
Or in some cases, your parents did,
yes.
Right? Back in the 50s, we all demanded processed food and fast food, and we got it, right? And now we gotta curb that a little bit. Not that there shouldn't be cheat days. I believe everything in moderation, right? But in general, we all, many of us could eat a little healthier.
Yeah, right. Well, so I was reading exactly what you're saying. I was reading an article the other day about, we recently just had the Luigi Mangione fiasco where he killed someone in the insurance industry. And it's easy to look at insurance companies and look at them as the boogeyman, right? And I'm not saying they do everything perfect, but if you look at the industry, they operate on pretty thin margins.
Yeah.
And this article was laying out, I don't think it was in The Economist, but it was talking about the main underlying issue in America is just that, health.
Yeah.
One, how we eat.
Yeah.
And then beyond that, you're not necessarily working on these, but the way we drive, a lot of people get killed or have to be hospitalized because of, traffic incidents or accidents, and then drugs. Yeah. Drugs are another big thing.
Sure.
What you're saying too is giving people another outlet for what you guys are doing. You're seeing people taking off drugs. So
if we can give people a hand up, right?
Yes.
If we can stand in the balance and provide resources that allow them to live a healthier life and pursue a healthier life, then they can become hopefully and oftentimes do citizens who are out there working, raising families, raising healthy families, and they may need a little help. Behavioral health programs that can, and drug addiction and alcohol addiction programs are so important, and those are epidemic proportions in our country as well, right?
Absolutely.
And so I do think it's biblical. From my personal perspective, I do feel that we have a obligation to our fellow man.
Yep.
I think Christ taught that to us when he was on this earth, that we have an obligation to help those who are in need.
Right.
And that's what I love about Open Hands mission is we're very solution oriented.
I love that.
Right? We are bringing the tools to people to take care of themselves and to take charge of their own health. And if they're too ill to prepare meals for themselves, well, then they've got them covered.
Stand
right?
in the gap with.
Absolutely.
Right.
And we're going to deliver those meals right to their front door. Right. So, and the right kind of meals too. That's so critical. So, yeah, I think we've got a lot of work to do in our country in terms of our healthcare system, but there is a lot of progress that's been made, and I can point to many managed care organizations.
Mm-hmm.
One that we have worked with is CareSource, and they are as mission-minded as Open Hand is, and another one is Molina Health, and these companies are really dedicated to providing social determinants of health.
Okay, yeah.
So not just primary care and hospitalizations, but they are investing in housing and they are investing in programs like Open Hand.
Yeah.
Because we've helped them understand, and they've done the math themselves. If we can give people the right kind of support, that will lower healthcare costs, and that helps these managed care organizations keep their costs down too.
Right.
Right. So there are programs across the country where their states have expanded Medicaid, and those Medicaid programs are actually covering the cost of what we do at Open Hand, medically tailored meals.
Fantastic.
Because they understand that medically tailored meals and nutrition counseling is not just a means to cure hunger.
Right.
It's a bigger conversation. It's a medical intervention.
Yes.
And if we view food as medicine, and
the
if we
most
view
fundamental medical
Right.
intervention, right?
if we will spend a little bit on providing people with the right kind of nutrition as part of their treatment regimen, right, we can save those managed care organizations a lot of money, right, and build a better quality of life for their members, right? And so that's the future of Open Hand. We are working on statewide growth, and we have already done some pilot programs with different managed care organizations. One is with CareSource. We worked with them to provide medically tailored meals to women with high risk pregnancies, including gestational diabetes. And sadly, Georgia is one of the leading, infant mortality is one of the leading causes of death for children in the country, but Georgia almost leads it out of the whole country.
I did not realize that.
I didn't articulate that very well, but you get what I'm saying.
We're at
infant mortality is terrible, exactly.
Yes, okay.
But if with the right kind of food, I think we can curb those gestational diabetes, in that third trimester. And so
when preeclampsia sets in and all that type of thing, yes, right.
And I think I really want to do more of that kind of work, right?
Right.
I want to help individuals of all ages who are battling serious health conditions, and that's the kind of partner that we like to work with, CareSource, Molina Health, but there's a lot of managed care organizations out there too. Kaiser Permanente is heavily invested and involved in this space too, one of our great partners. And so, my hope, my vision is that one day, anybody who needs a medically tailored meal, like who really needs a medically tailored meal because they're battling a chronic health condition or they're at great risk, right, and they need our level of nutrition, I hope they'll have access to our services anywhere in the state of Georgia, regardless of where they live and their ability to pay. Wow. Right? I think that would be a wise investment. We're not quite there yet, but we'll get there one day.
Yeah, I totally agree. I mean, like you said, it's the most beneficial treatment or prevention of having to do treatment further down the road.
Right.
and it's the most cost effective. I mean, food, there's probably no drugs out there that are cheaper than, a dozen eggs and
Listen,
some
you can, I want to get this
salad.
right. You can feed someone 2 meals a day, healthy food, like the meals that we prepare at Open Hand. You can feed someone for 6 months for the same cost of the average 1-day hospital stay, right? So
Wow.
if we feed people the right kinds of food and we keep them out of the hospital, we
Right.
can save our healthcare system so
Yeah.
much money.
And get
right?
people off of Lipitor and,
Right.
blood pressure medications.
And not that pharmaceuticals are always bad.
Right, of course
Thank
not.
goodness for
Yeah.
pharmaceuticals. But
Right. Oh, very thankful.
we like it when doctors are prescribing food
Yes.
instead of having to prescribe medications, right? That's the direction we ought to be heading in.
Right. Well, I mean, drugs always have some type of side effect too,
Yeah.
right?
Oh,
So
yeah. Right.
it's not as clear cut as eating right. You know,
Right.
there's no side effect to it.
Right.
Drinking water, eating healthy food, that's
So
just
true.
what we should be doing.
I'm glad you brought that point up. 'Cause
Right.
That's so true. Yeah.
So, but okay, so I was thinking about I think the reason why you guys, so you were even talking about biblical, and I was like, yeah, in the Bible they didn't even have to worry about these type of things quite as much. Like most of the food, it was all whole food,
Right.
Like it was pretty good. But now, I love capitalism. I run a business. I'm passionate about it. I'm passionate about capitalism doing better in other parts of the world.
You work your butt off. You ought to
Yes.
be paid for it.
Exactly. But one kind of, again, there's cause and effect, right? I mean, I went to school for economics, so I'm always thinking about the trade-offs, right?
Right,
So
right.
with food now, it's more profitable in most cases for, food producers, companies. They want to create shelf-stable products that can just sit there for forever,
Yeah.
and maybe not forever, but for a long time. And so even in our own life, and my wife she's the nutritionist of our family. I mean, I've learned so much since marrying her, which has been great.
Right.
But I mean, I still feel like even with having her around, who's very ardent, it is tough to stay on, so without some help, and we had a lot of resources,
Yeah.
not a lot of resources, but we always had work, and, we could afford to make better decisions with our food, and we had access to information. We both went to college. I remember health classes in college being beneficial and that sort of thing. So, but that was all the way to college. I don't
Right.
think we talked about it in high school very much, and it just is a constant battle. And if you're in a bad situation economically, you don't have resources, as far as, now there's more through YouTube, and I know you guys do a lot with video and
Yeah.
teaching people to cook, and you're taking full advantage of that. But I just think what a battle you guys have on your hands, but what an
Yeah.
incredible job you're doing with it, because
thank you.
It's going to always be there, because there's always this pull towards, let's eat the easy thing,
Yeah. I think we're trying to supplement what what school systems don't do anymore, or not all school systems,
Okay,
right? So
yes.
first of all, we're not feeding kids in school the level of nutrition that they need.
Right.
And it's sad. That's a sad fact that in this country in 2025, we're still not investing in the right kind of nutrition for kids in school.
Right.
And all the studies show that if even the right kind of breakfast will help kids learn better, right? Their brains function better, right? And so that's a low cost investment that we should be doing. But there used to be home economic classes taught
Right.
in high school, and a lot of practical information, the same kind of information that we teach in our cooking classes.
Right.
And I'm not sure why those disappeared from the school curriculum.
Me either.
Right?
That's a mystery.
But one of the favorite things, because you mentioned, it's true that in our country, this is a capitalist society,
Yeah.
and rightly so. Food companies, many food manufacturers out there are trying to make a profit. There's nothing wrong with that.
Right, of course.
Though I think the way they go about that could be modified, right?
Yes.
They're putting all kind of preservatives and all kind of fillers in food, right? And they're willing to cut the quality of food because it's frankly more profitable to do so, right? And then there's huge food monopolies out there with a lot of political clout.
Yes.
And there are, frankly, a lot of food manufacturers out there who don't want to see our country go in the way of healthy foods.
Certain
right?
ones, right, that are probably more into the
so true,
shelf stable,
so true.
Those type of products,
and
junk food, basically.
Yeah, I think about when Michelle Obama was the first lady.
Oh yeah,
and she really tried hard to revamp the kind of food that was being served in schools, and she got shut down. Frankly, she was absolutely told that you can't do this. This is outrageous. And so she changed her campaign to really focus only on exercise, because she got shut down because there's so much political clout. And whether people like Michelle or not, the first lady, I think most people would agree that we ought to be investing in our kids, and we ought to be investing in the kind of foods that they're eating.
Right.
And the school system has got some work to do on that. I'd love to work with the school system.
Okay.
I'm sort of starting with charter schools.
Okay, good.
And exploring ways that we might be a meal provider, especially for kids who might be facing a chronic illness. Like maybe we could supplement what those charter schools are doing. So,
wow.
One of the things we do in our cooking class that I wanted to mention is we take kids and families on virtual grocery store tours.
Oh, that's great.
Right, so we're teaching them which aisles they should shop on to get the healthier foods.
Stay on the outside, is that
right? And we even did a marketing campaign with a wonderful grocery chain that is in a lot of low socioeconomic neighborhoods. It's called Wayfield Foods, and they wanted to increase utilization of fruits and vegetables. And so we got a grant, and we got permission from the folks who own the Big Bird and the Sesame Street character rights to that.
Fantastic. Oh.
And we made huge Big Bird stand-ups and banners, and we had big Bird feet that we stuck to the floor right from the front door that would lead you back to the fruits and vegetables aisle.
Wow.
And of course, if you're a kid, the first thing you're going to do is see those Big Bird footprints and follow that immediately.
What a
right?
great
It's like
idea.
a game. So,
yes, it's like a little nudge.
Yeah.
I'm big into.
We
Richard
also
Taylor wrote a book about that. That's
I love
great. That's a great example of a good just nudge.
Right.
Costs almost nothing, but
yeah, that's right.
Wow.
I think teaching people how to read a nutrition label, that's another really practical skill that we're teaching in our cooking classes. So if something says it's low sodium or low fat, how do you know?
Lower than what?
And because a lot of time it's not, right?
Yes.
And so all kind of practical information that we can do in our Cooking Matters program. And we have piloted it in some school systems. Some school programs have hired us to come in and do cooking classes, and we can either do it on an 8-week period, or we can do 1 or 2 days of classes. And I'd like to do more of that too. I'd like to do a whole lot more of that.
Oh, that's fabulous. Wow. So real quick, just for a little case study, I was saying I live in this neighborhood, East Lake, or it's right next to where we are right now. And it was a bad place 20, 30 years ago, and you lived in the area too, right back then. So how would you guys, I didn't even realize that you guys were working with there's the East Lake Foundation, and I can give a little bit of story on that. But how did you guys get involved, just as an example of how you guys are transforming communities? Because we've lived here 10 years, and the place has come a long way even in that amount of time. They used to call it Little Vietnam for all the crime and shootings and things like that would go on, and now people were building $1 million houses in the neighborhood, which isn't, it's not maybe the best, but the point is they want to do that. Like, people are willing to go invest money into this area now. So
East Lake and other communities too, like Vine City, like where Open Hand resides over there in Grove Park.
Yes.
Oftentimes we're referred by funders.
Okay.
So Invest Atlanta is a phenomenal organization that oftentimes provides startup capital and invest in communities that are economically depressed, and provides those communities with funding to secure resources like Open Hand or like the YMCA, right? Or like job training programs. And or recreation, and investing in those areas, because Invest Atlanta realizes that if you bring those kind of resources to a community that's in decline,
Right.
you can help revitalize it, right? And so over in Eastlake, I think that we got introduced to that community really through the YMCA over there, through
So
our
you'll work
partnership.
a lot with the YMCA.
Yeah.
In partnership.
We've done education programs over there. We've done farmers markets, pop-up markets over there. They are oftentimes referring people to our meal plans. Also, they're referring some of their clients who have the ability to pay to our social enterprise, which is called Good Measure Meals.
Okay.
So we sell our delicious, healthy meals to the paying public.
Yeah.
It's an e-commerce product.
Yes, I was going to get you to talk about that.
Yeah.
You can subscribe
You
to
sure
your
can.
meal plan, which I need to do.
You pick out the meal you want. You want 3 meals a week. You want 10 meals a week, right?
And you drop them off once a week, or
once a week.
Okay.
We'll bring them right to your front door. They're frozen. You put them in the freezer, and then they're ready to go when you want to eat them,
Yes.
right? But they're all, very few preservatives, very few canned goods. The Y is one of our great partners, and so the Y refers many of their members to our Good Measure Meal program.
That's fantastic.
Because again, they're focused on building healthy communities, and they recognize the importance of nutrition, and it's a beautiful marriage that we have with the Y, right?
Wow.
And that's how we got involved over at Eastlake, and also over in the Vine City area. We also have many other referral partners too. The Visiting Nurse Health Services, phenomenal organization where they have patients who may have Medicaid waivers who help to. Those waivers can be used for healthy foods.
Okay, right.
And so we're offered time delivering meals, and sometimes in very low socioeconomic areas.
Right.
There are dollars through the federal government called Ryan White dollars that help us to provide meals to people living with HIV in low socioeconomic areas. There are senior centers all throughout Metro Atlanta and really throughout the state of Georgia, and many of them we serve. So for seniors who are healthy enough to be able to travel to senior centers, one of the primary attractions to going to that senior center is to receive their meals.
Yes.
And that meal time is both social, it's recreation, it's bonding, it's fellowship, but it's also getting healthy nutrition.
Right.
And so I'm proud to say that we have grown to be the largest provider of home delivered meals and congregate meals too in the Southeast, and one of the largest in the country. And seniors are the largest segment of whom we serve. And so
Right. And that's probably growing as baby boomers.
Oh,
are
absolutely.
growing
all
in
these,
age.
right. We're not quite ready as a state to take on all of the baby boomers that are
Right.
coming our way, but we're getting there. We're getting
Wow.
there, right?
You are a man whose future is secure as far as the work that you have cut out for you, because you've got so many of the issues we've been talking about. I mean, it's a huge
I think there's
job.
always going to be a need for access to healthy nutrition, right?
Yes.
And I'm just grateful for all the volunteers, for all the donors who help us make the magic happen.
Right.
Those 14,000 volunteers in our database. Any day that you come to our Midtown campus, our West Midtown campus, you
It's a
may
beautiful
run
place,
in.
by the way. Beautiful.
We're pretty proud of it.
Yeah.
We just moved into it last August.
Yes.
And
Right on the Beltline.
Right on the Beltline,
Incredible.
which is another phenomenal organization that
Yes.
is invested in investing in communities and putting people to work and helping people to be healthy. They're a great partner of ours too. But yeah, we love what we do at Open Hand, but we couldn't do it if it weren't for all these volunteers. We sometimes have 30 to 50 volunteers on our campus who are helping to deliver the meals in their own vehicles, using their own fuel.
Amazing.
They're on the packing line. They're saving us all kind of labor costs. We save the community about $1.4 million a year because we use volunteers so effectively, right? And
right.
the first 2 years that Open Hand existed, this is a fun trivia fact. The first 2 years that Open Hand existed, and we cooked meals, and I wasn't there. This is my founder, our founder, Michael Edwards.
Pre-Piper.
Pre-Piper, definitely pre-Piper. There were no paid staff. The first 2 years, it was all volunteers.
All volunteer.
Cooking out of a church kitchen
Is
in
that right?
St. Bartholomew's on La Vista Road, right?
Okay.
We're not a faith-based organization. We
Right.
welcome people from all walks of life. We serve people from all walks of life.
But you partner with a lot of
We
your donors
partner with a lot of
yeah.
faith organizations, right? And we love it when faith organizations come to volunteer. We love it when corporate groups come in to volunteer. Families sometimes will come volunteer together.
That's so cool. We need to do that. Okay.
It's a lot of fun too.
Yeah.
It's a lot of
Yeah.
fun to volunteer. So it's one of the favorite aspects of what we do, because to me it's a form of community activism. We're inviting the community to come be part of our mission, right? And because we're mission minded and not profit minded, we're not going to cut the corners on really being committed to healthy food and to nutrition education. And fortunately, the community has really gotten behind us on that too, and that's very validating. And you know, Atlanta's a very generous place. It really is.
It really is. That's true. Wow. Tell us a little bit about Matt Pieper. What do you do when you're? Well, I know you're working probably most of your time, right? But when you're not working, what are you up to?
Gosh, you know what? I love to ride my bike, and I
too.
live near the Greenway Trail.
Okay.
I'm in Roswell, but that's just a hop and skip from my house up in Alpharetta. I like to read a lot.
Yes.
Pat Conroy is my favorite author. Most of his books take place in the Southeast on the coast, so there's a lot of history in his books, right? And I just think he's a phenomenal, one of our best Southern writers, and I love reading.
Do you ever read Eric Larson, by the way?
I don't know his stuff.
He wrote Devil in the White City. He writes, it's nonfiction, but he writes it almost like it's laid out like a story, like it's fiction. He does a tremendous amount of research. But he also, one of my favorite, he wrote a book called In the Garden of Beasts, which was about the American ambassador to Germany during the 1930s and about his family and all the espionage that was going on with that
cool.
family. It really, anyway, sorry, that was a side
Eric
track.
Larson?
Eric Larson.
Larson, okay.
Eric Larson.
I got to remember that.
I'll get you one of his books. That's a good one to start on. But anyway,
Awesome.
sorry. Okay,
Awesome.
big
That's
reader.
great.
Okay, and fiction.
Reader.
You read a lot of.
Yeah, I love to travel. I've
Yes.
been to many countries. My happy place is the beach.
Yes.
I any chance I get, whether it's a long weekend, you might find me on Tybee or
Is that
Isle
right?
of Palm or
Yes.
Pawleys Island or St.
Maine.
Simon's.
You guys went to Maine recently, right?
Up to New England, had a spent 2 or 3 weeks up there, just hopping from coastal town to coastal town, right? Although spent some time up in the mountains in Lake Winnipesaukee.
Oh yeah. Okay.
Took me a long time to pronounce that, right?
That's a tough one.
Beautiful part of the world up there. A little
Wow.
cold. I didn't get in the water, but
Okay. Yeah. You didn't want to practice your cold plunge.
Right. So yeah, that's a little bit about me. I come from a really large family. I have 11 siblings, right? And so I'm number 11 of 12 of us. And probably part of my passion for nutrition really did come from my mom, who was terribly vain. And so I think she was always, very conscious of portion control and always wanting to. She did make meals from scratch, and part of that was economic driven. Like she had to, she was feeding 12 children.
Yeah,
She had to really economize, right?
Right.
And so, and we, we had a lot of my brothers and sisters playing sports and doing, extracurricular activities after school. So oftentimes we would eat at different times, right? So you would come home and Mom would have made maybe 2 different entrees, right? So, and then on Fridays, she'd probably combine those 2 entrees into one big stew or something, or some goulash, right? So she could really squeeze a nickel when it came to food. But she was a woman who cooked a lot. We didn't eat out a lot, really, because of economics. It was just too damn expensive to go out and eat, right?
No doubt.
Yeah, wonderful family.
And you grew up in Georgia, or where were you?
Yeah, the first half of my family were raised up north.
Okay.
So they're the Yankee half of our family. And then, although I was born in Long Island, soon after I was born, my dad was transferred down to Dunwoody, Georgia, which back then was pretty rural.
Right.
We were one of the first outlying suburbs of Atlanta. And so the second half of the family, we were really raised down south, went to elementary school and high school, and many of my siblings went to the University of Georgia with me, and so
you did, yeah.
Go Dogs.
Yes, okay. Wow, fantastic. Well, thank you so much, first of all, for doing this. This
Absolutely.
is just a huge honor to have you. You've been such a great example. For me, we know each other originally through Rotary Club and then some work that we did
Gluttons
together
for
at Buckhead
punishment, aren't we?
Church. Yeah, that's right. But I've learned so much getting to hang out with you, both about what you're doing and
Back
just
at you.
being a great leader and so many fantastic things. But can you tell people if they want to get involved with Open Hand, what should they do? Obviously, you guys are a nonprofit, so you can donate, but you could also volunteer. What's the best way to get involved?
Come
How to get in
volunteer
touch?
with us, because if when you see our campus and when you see the scale of what we're doing, and you get to witness all of the incredible food that's being prepared in our kitchen, and you get on our packing line, and you can see the quality, and there's music playing, and you're with your peeps, whoever those might be, and you're wearing silly hair nets, right? And
So bring someone, you're saying. Too.
Oh,
You could
absolutely.
bring a
Come
crew.
do it with friends. Do it with
Okay.
your colleagues. Bring your church members, your synagogue members.
Yes.
Bring your family, and we'll put you to work. But you'll definitely feel rewarded afterwards.
Yes.
And we love that we have a really high retention rate and also a repeat rate for volunteers. I think people do have a good time and
Definitely.
feel great that they're part of a solution, right?
Right.
And so that's a wonderful way. Anybody can go to our website, which is www.openhandatlanta.org. Easy to register to volunteer. And we love it when people register in advance. We typically are running 2 shifts right now during the weekdays. And then we also are open on Saturdays for delivery. The kitchen goes dark on Saturdays,
Okay.
but we do have a lot of volunteers who come in on Saturday to deliver meals.
Food. Wow.
We love having volunteers come help us with our cooking classes,
Yes.
just to sort of running errands and being an extra set of hands.
You might learn something too, right?
Right.
When you're around for a class.
We love it when families, when they bring their younger children who may not be quite tall enough or old enough to work on the food line, but we have them draw greeting cards with their magic markers and crayons and paper that we give them. And the greeting cards are oftentimes get well cards for some of our clients who are not feeling well,
Yes.
right? And they love
Yes.
getting these greeting
That's
cards,
such a special thing.
from these little kids who have, sweet messages on them. And
Yes.
that just really brightens the day of our clients. So there's something for everybody.
Yes.
So we absolutely invite people to get engaged with us, come volunteer. We do rely on philanthropic dollars, and there are all kind of donation links on our website. And if you're passionate about creating access to healthy food, and you've got a little extra change hanging around, we would greatly appreciate donations. And then check out our Good Measure meal plan, our social enterprise. Here's a true confession. I don't cook. I run a nutrition agency. I know.
But you don't have to because...
But I don't have to because
Yeah,
I'm a Good
yeah.
Measure meal customer, and I love our food, and I want to eat healthy, and I feel great that I know that every 2 meals I'm purchasing are providing enough funding to provide a healthy meal for someone who can't afford to pay.
Right.
So it's a win-win for everybody, and those meals are delivered right to my door. So check out Good Measure Meals. Great way to support us and also to get food to your family.
Fantastic. We're not going to McDonald's after this, then, I guess, right? No.
Every once in a while is okay.
Okay.
Just don't make it your go-to.
Yes, exactly. Matt, thank you so much again.
Drew, thanks for
Sir,
having me.
It was such an honor. Appreciate you.
Absolutely, buddy.
We'll do it. Hopefully we'll do it again.
Yeah, come on. That'd be great.